All right, I'm going to take over the next section or two now, and I want to talk about patients that have COVID. Um, if you haven't already, you should have a fairly robust telephonic screening prior to the patients arriving. Um, and we want to use telemedicine expansively to the extent you can, and also, as Jehan was pointing out a bit, do as much as we can to figure out as much as we can before the patient arrives. A patient calls up, I need to come in for XYZ, and you say, sorry, we're not treating you because you have COVID. You're going to have multiple problems on that. So item one, avoid abandonment, and also avoid discrimination based on a medical condition. You don't have the ability just to deny someone treatment because they're COVID positive. Now, we do want to take steps to limit the exposure to other people in the office, and some of that can be from an engineering standpoint. Also, it can be from a scheduling standpoint. Not a bad idea. If you know someone is positive, you have the PPE to treat them. Let's maybe bring them in at the end of the day and have all of the positive patients at the end of the day, so that and none of the non-positives at the end of the day. So you've already got a pool, and then you also have the ability to have the thorough cleaning after the COVID positive patients have come through. Of course, to the extent you can interact with them and deal with them via telehealth, that's obviously preferable. And we started talking about this quite a bit in the last section, but the personnel need to be adequately and thoroughly protected with their personal protective equipment. But do make sure you are not simply writing people off because of a medical condition or getting involved in patient abandonment. That's not an option here. So that's someone we know before. Now, what happens if we kind of discover it during the treatment? You will need to notify the public health officials. There is a HIPAA exception for that. You're allowed to do it. So you're either local, county, or state in the CDPH is going to need to be notified that you have a COVID positive patient. Those employees that have had interaction with that patient will also need to be notified, and then they start going through the process that we talked about previously, possibly self-monitoring, but there's also kind of a more thorough guidelines that we can look at our chart, which we'll turn to in a moment. But the employee disclosure, you interacted with someone we've now determined has COVID, so your employees get drawn into the mix. And then, to the extent this person came in, and let's say the morning sessions when you thought it was all COVID negative patients, if the COVID positive patient would have interacted with other patients, you're going to have to reach out to them and let them know they may have had exposure to a positive patient. That's just another great reason why, to the extent possible, we want to limit waiting rooms and the like, where a number of patients are together for any sort of extended period of time, because you are going to have to go through that contact tracing aspect of things to disclose to the other patients that they need to be isolated, tested, or what have you. Do keep in mind that you need authorization to disclose to the patient's employer. The HIPAA exception is for the governmental entity. It is not for the employer. So if the patient wants you to disclose that, then make sure you got a written authorization in the file. If they don't want you to disclose it, make sure that you and the staff know that that needs to be kept in confidence. Okay, so the CDC has provided a nice chart for your exposure categories compared to what you should do given the PPE that was used at the time. Obviously, if you know someone's positive, you want to get maximum protection but let's say it was understood that the person was not, but then later discovered they were. You can use this chart from the CDC to figure out what that employee should be doing, and if there are going to be work restrictions while they are asymptomatic. Obviously, if they're symptomatic, then as Jehan talked about, they need to go home until they're negative. But this breaks it down quite nicely on the risk categories and the PPE and exposure levels compared to what you as the employer need to be telling them to do. So a helpful chart there. Patient volumes. We hope now that we're into this a number of months that they are starting to recover, if not have recovered. The difficulty there is that you've got, as we talked about, new engineering issues and the like. Really, the waits in person need to be diminishing. You need to figure out ways to have people not wait in person in your office. And as well as possible structural engineering, plexiglass, separate rooms, what have you, of waiting room for people that are symptomatic or testing positive versus those that are not. Our experience is that we are seeing volumes growing, and quite frankly, they need to be for a lot of other issues besides COVID-19. People need to get their treatments and their visits back online. One issue is that we recommend reaching out early and often to schedule if there's OR time that's going to be needed. You can also go to outside surgery centers to the extent the hospitals are filled or patients might have hesitation there. So be mindful that patient volumes do, if they haven't already, they do need to go up for everything else besides COVID because there are reports of negative consequences for people who have just been deferring treatment, that while it's not emergency, it is still necessary. And so you want to be proactive there. CDC and Centers for Medicare Medicaid are providing more guidance on returning patients and how to interact with them that we can provide for you to the extent you need them. So that is an overview of dealing with the patients who we thought were negative, we screened them, and it turns out they're positive, or patients we knew that were positive. And so just want to open it up for questions there to anybody who might have questions on dealing with COVID patients.
I don't see any questions at the very moment. And looking at the clock, I think it'd probably be good to move on to the next section. And if we have anything else, we can do it at the very end.
Yeah, absolutely. And so